And today we're going to be talking about the options for ADHD treatment. And with us today is our very special guest, clinical psychologist, Dr. Stephanie Sarkis. Hi, Stephanie. How are you today?
Hi, Jenny. I'm great. Thanks for having me on again.
And it's great to have you. Stephanie, before we get started, I'd love for you to tell our viewers a little bit more about your background and what you do every day.
Sure. I'm an American Mental Health Counseling Association diplomate and clinical specialist in child and adolescent counseling. There's about 20 of us with that dual designation in the U.S. I'm a licensed mental health counselor, national certified counselor, and I'm based in Tampa, Florida. So I work primarily with people that have ADHD and also autism spectrum disorder and anxiety.
Okay, great.
Oh, and I've written some books on ADHD too.
Right, great, and I've read them, and they're wonderful, and
Thank you.
A lot of the questions from this chat actually will be part of what is in your book, so that's really great. Let's work from that premise. All right, and for our viewers, Stephanie will be taking your questions throughout the chat, so please just type them into the chat box. We'll get to as many as possible throughout the chat. So I think we should begin, Stephanie, with just if you could tell us a little bit more about ADHD symptoms and causes.
Sure. ADHD is primarily inattention is one type of ADHD, and then there's hyperactive impulsivity. And if you have both of those types, you have the combined type. Inattentive type are things like difficulty focusing during tasks, difficulty with organization, difficulty following multi-step directions. And the hyperactive impulsive type are things like difficulty with staying seated when seen is expected, feeling like you're on the go and driven by a motor, interrupting, maybe talking out in class without raising hand first. So those are the symptoms of the inattentive type or the hyperactive impulsive type. And again, combined type is when you have both of those. So, and the onset usually is before the age of 12, and symptoms tend to go throughout your lifetime, and it is inherited. So there's a pretty good chance that if a child has ADHD, that one or both the parents has it as well.
Okay, great information, Stephanie. So there's a lot of discussion, especially I think when kids are really young, about whether ADHD is overdiagnosed. In fact, is ADHD overdiagnosed or underdiagnosed perhaps?
I get that question a lot, and actually studies show that it's underdiagnosed, that out of people that have ADHD, only about 10% see a mental health professional in the first year that they realize they have symptoms, and that number never really gets to be over 20%. So that means about 80% of people with ADHD are actually not diagnosed with it and treated.
That's really interesting. And what are the consequences of that, do you think, Stephanie?
The consequences of it are you have this what's called loss of potentiality, which means that what you could have been, you just don't reach that. There's a gap between your ability and what your performance is. So that means that you have 160 IQ, but you're getting B's and C's in school. Or as an adult, you have difficulty following the kind of rules of your job, but you're not really sure why. Difficulty completing projects, whether that's a school project, book report, or even up to adulthood, not completing a work project. So it really impacts self-esteem as well. And there's also a higher rate of substance abuse in untreated ADHD.
Okay, great information. So what should our parents know about medications for ADHD treatment? Let's start with medication. We're going to explore all kinds of options, but as far as medication, what should parents know?
Well, stimulant medication has been in the U.S. since 1933, and stimulants in research has shown that those are the most effective treatments for ADHD at this point. There are also non-stimulants. Non-stimulants have been found in head-to-head studies to not be as effective as stimulants, and also the FDA has given approval for those to be prescribed together. Side effects of stimulants can be dry mouth, some difficulty sleeping, appetite suppression. Side effects of the non-stimulants can be drowsiness, and you don't want to stop those kind of cold turkey. You don't want to stop them without checking with your doctor first with the non-stimulants. The stimulants, the short-acting ones, last in the system about 3 to 4 hours. Long-acting, about 6 to 8 hours. Depends on how your body uses or burns off the medicine in your system. And the non-stimulants stay in your system, so that's why you can't stop them cold turkey. You have to keep taking them for them to be effective.
And how do parents weigh out the benefits of ADHD medication and the side effects? How do you find that sweet spot?
Well, I think it really depends on how much your child's quality of life is being affected. I notice even kids in kindergarten, their self-esteem starts being affected because they're getting in trouble at school for not being able to sit during circle time, or they're having a hard time connecting with peers. So it really depends on how much your child's quality of life is being affected. So, and also, if you look at ADHD as an issue with your brain chemicals, that you have low levels of what are called neurotransmitters in your brain, medication is one of the kind of regulated ways to get those chemicals back up. Because as you get older in your teenage years, without medication, teenagers are much more likely to use substances. So sometimes it's the option of do you want to get your child on something that is a substance abuse preventative, or is it possible that without treatment that they're maybe more prone to using street drugs and things like that? So it really comes down to how much is your child's quality of life affected.
Okay, great. Thank you. We have a question about ADHD medication, so I'm going to jump to that from one of our viewers, Nabini's. She writes a lot, but I'm going to just kind of be brief. She has a 15-year-old who was just diagnosed with ADHD, but he also has tics. So she's considering non-stimulant medication. Would you think that that would be appropriate for someone with tics?
I wouldn't be able to answer that because I didn't go to medical school, so I would refer to your pediatrician or your child and adolescent psychiatrist to ask that question, because I really can't answer that, and I would need to know his specific case and do an evaluation. So I wish I could answer that, but I can't.
Okay, thanks, Mel. Okay, thank you. That's great. Megan asks, would you say that children are more often unfairly diagnosed? While those who do need it go undiagnosed. So we're kind of piggybacking from the earlier question. She thinks that parents use ADHD medications to control when a child doesn't meet expectations. So do you want to weigh in on that, Stephanie?
I think, and studies show, and I guess from my practice that I've seen more often, that people respect the medication, and parents are working really hard to use positive reinforcement and consistent parenting, and sometimes that doesn't always help 100%. So in my case, I see more of a case of parents that respect the medication and are working really hard.
Okay, great. Thank you. AC wants to know, how would a doctor, again, you're not a medical doctor, but maybe you can weigh in on ADHD and anxiety. So do you see there's an influence there or a relationship?
Yeah, and one of the things I specialize in is having ADHD with other things like depression, anxiety. And anxiety happens about 50% of the time when you have ADHD. So that means that if you have 100 people with ADHD, kids, adolescents, and adults, about 50 of them also have anxiety. And that can be social anxiety. It can be general anxiety. In some cases, OCD. There's a 30% chance when you have ADHD that you have obsessive compulsive disorder. So there's a pretty high correlation of those. Sometimes you're born with the genes for ADHD and anxiety at the same time. And sometimes you develop anxiety because you're having to work 5 times as hard as everyone else and only getting half the amount of work done. And you get in trouble in class for not raising your hand and speaking out. So you become anxious. So sometimes when you treat the ADHD, the secondary anxiety gets better. But if it's primary anxiety and depression and ADHD, where you get the genes at the same time, sometimes you need to treat those together.
Okay. I have one more ADHD medication question, and then I'm going to go to some non-medication treatments. CS wants to know, if ADHD medication does not work for a child, can we assume that the child does not have ADHD at all?
Not necessarily. Sometimes it's a change of medication, a change of dosage, and sometimes stimulant medications don't work for everyone either. So that doesn't necessarily mean that the person doesn't have ADHD. It used to be thought that that's kind of how you diagnose. If the medicine works, then you have ADHD. But we found that that's not the case. So it may just be that another treatment needs to be looked at, or again, a change of dosage or change of medication.
Okay, thanks. All right, so let's move away from medication for a bit and talk about counseling and coaching. I know that ADHD coaching has become, pretty popular lately. So how important are these kinds of treatments for kids with ADHD or adolescents as well?
Well, studies have found that counseling and medication work better together than either treatment by themselves for ADHD, and that's for kids all the way up through adults. The most common therapy modality that you see for ADHD is called cognitive behavioral therapy, and that has the most data behind it as far as how effective it is for ADHD. And in CBT, we talk a lot about how those negative kind of recordings in our heads play, especially when you have ADHD. So if a kid's given a new assignment at work, they may think, I'm never going to get this done. I'm not very smart, when in fact, kids with ADHD can have the same, IQ as everyone else. So one of those things you talk about is how can we rephrase that or change the way that we think in order to feel better about ourselves? Because again, with ADHD, the self-esteem really takes a hit really early on. So that's the most common form of therapy for ADHD. And then coaching is, I call it kind of counseling light, because you're not getting into your feelings as much as you're helping students set up a structured schedule. You're helping let parents know about accommodations that might be available in the schools. So it's more working on the kind of, I would say, logistics and the ins and outs of daily life. And then counseling gets more into issues of self-esteem and possibly depression, anxiety.
Okay. Medical Yoga Mom has a question. She has a 10-year-old son who she says is on the cusp of an ADHD diagnosis. She has an older son with ASD, and she highly suspects that her husband has both. She is seeking a therapist for herself. She's already put her sons in therapy. What type of therapist would you recommend for her, and what types of therapy might work best?
Well, at first, I think it's great that she's seeking her own therapy, because I think being a parent of a kid with issues can be really stressful. And there is a lot of information out there to learn. It can be kind of overwhelming. So first, I think that's a great idea. Also, the type of therapist you need really depends on who you click with. And what I tell people is, when you call someone, ask them what they know about ADHD and autism spectrum, and see if their answer kind of goes along with how you feel about those disorders. And then also, when you meet with someone, it may be that you don't click with somebody the first time you meet them. And that's okay, and that's totally normal. And there are also other people available that will talk with you. So again, a lot of it's personal fit, and also if you kind of are on the same page with that person as far as what you believe about ADHD and autism spectrum.
Okay, great. By the way, thank you all for your questions. We have several more coming in. Rachel would like to know if you can speak to the results that you've experienced with neurofeedback and ADHD. And maybe with that, you can explain a little bit about neurofeedback.
Sure. First, I'll just say that neurofeedback in several studies has not been found to be effective for treating ADHD. That's where you have electroencephalogram, the stickies on your head, and you get that's the paper with the squigglies on it telling you what your brain waves are. The idea is that you can help yourself focus by using your what are called beta and theta waves in your brain, and that you see an animation on a computer screen move when you are using your focusing waves. And when you're not using your focusing waves, the animation stops. And again, there have been several studies that have come out even as recently as this year stating that neurofeedback is not effective for ADHD. And it can also be quite expensive, and insurance does not cover it.
Okay, great. Thank you. Stephanie, let's talk about exercise and what I think you refer to as green therapy. What did the study show? Are they effective?
Exercise is one of the most effective non-medication forms of treatment for ADHD. Even exercising for about 30 minutes or so helps improve the functioning of your frontal lobes. And when I talk about frontal lobes, I mean what are called executive functions. And those are things like organizing, thinking ahead, planning, and that's impaired in ADHD. So again, if you exercise even 30 minutes, you tend to improve what look like ADHD symptoms. So you'll be able to maybe string your thoughts together better, or you may be able to put your items together before you leave school or leave work. So again, even exercising for 30 minutes helps with that. And there are some studies saying even 15 minutes of exercise helps improve that.
So that should be built into a child or adolescent's routine. That would make sense then.
Yeah, I have it recommended that on 504 plans and IEPs that it's put in there that recess is never taken away, whether it's for standardized testing, whether it's because of classroom behavior or not turning in assignments, that, again, kids are allowed to go outside and play. Because recess is where we learn our social skills. We learn really quickly on the playground what works and what doesn't, and it's essential that kids have that time. kids are not made to sit in the classroom all day. So again, I would strongly urge people to have that put in the 504 that recess is never taken away.
Okay, great advice. Take heed. Okay, great. So we hear a lot today about movement and even background sound. What's your experience, or what does the research say about movement and background sound when it comes to kids or adolescents with ADHD?
Well, there are no set prescribed movements that help. So what that means is that programs that say that if you move this way or that way, it's going to help integrate the brain and it'll help with ADHD, those have been found to not be effective. The most important thing is just movement. So movement in the classroom, whether that's sitting on a chair you have to balance on a little bit, or moving around the room with centers around the room, multimodal teaching, having a minute of exercise, doing jumping jacks between changing subjects has been found to be quite effective. Anytime you're stimulating the cerebellum, which is in the back part of your brain that does movement and balance, it helps your frontal lobes focus. So also background sound blocks out all the little extraneous noises in the background, like a door creaking when it opens or wind blowing or whatever it is. And so people that listen to music while they're working, even a white noise app or machine, that really helps people focus better.
Okay.
And that's not a one-size-fits-all. Sometimes people need complete silence to be able to work too. So you have to just try out different things and see what works best for you or your kid.
Okay, great. All right, what about supplements now? Are there vitamins, or I think there's something called nutritional food or something like that. Is that important for kids? Should parents be paying attention to these recommendations?
Well, supplements overall. So supplements, when I'm talking about that, I mean vitamins, minerals, omegas, herbal supplements. First, people with ADHD don't have any different vitamin or mineral levels than anyone else. So I really urge people to check with your pediatrician before taking large doses of vitamins, because your child may not necessarily need those. Also, omegas have been found to be somewhat effective in treating ADHD. In as little as 4 weeks, they help neurons communicate more effectively. And also, herbal supplements have not been found to be effective in studies. And that includes kava, valerian root, St. John's wort, ginkgo biloba, and ginseng. None of them have been found to be effective. So out of those, again, omegas have been found to be the most effective.
Okay, great. Thank you. And while we're on the subject of that, what about diet? Is sugar bad? Are there recommendations? Are there foods that kids should be eating? What's your recommendation, Stephanie?
Well, first, I think the most healthy diet for someone is helpful whether you're ADHD or not. So that's cutting out refined sugar, high fructose corn syrup. Sometimes people find that if they eliminate dyes and additives, that helps. Some people find if they eliminate sugar completely, that helps. There is a higher rate of diabetes type 1 and type 2 when you have ADHD. There's some genetic links there. There's a higher rate of having celiac disease or gluten sensitivity when you have ADHD. So I always recommend that people just if they're having stomach issues, to have that looked at by their doctor, just to eliminate what else might be going on. And also, there are restrictive diets that have you remove a bunch of food at once to see if that impacts your behavior. What we're finding, though, is that it's not that sugar causes ADHD, but if you have ADHD, it kind of spikes you up to a higher energy level and then drops you further. So that's that crash you see in all kids, but it seems to impact kids with ADHD a little bit more. So healthy diet is the most effective thing to do. And I recommend that the parents meet with a registered dietitian, and they can help you, kind of point you in the right direction, especially if your kid's particular about what kind of food they eat. I don't like the word picky. I think there's a negative connotation to that, so it's particular. So they can kind of gear you towards options that are healthy for your kid, and also that your kid will enjoy eating.
Okay. All right. I'm going to go back to some viewer questions now. Here's an interesting one. I think that your explanation will come in handy for lots of parents. So LG's 7-year-old just started Concerta, and she's having a hard time explaining to him why he needs it. She's not used the word ADHD yet. She's just said, it will help him focus. He says he feels like he doesn't need it. So how do you approach this? I'm sure a lot of parents are concerned about this.
Well, I say to kids, that everybody's brain works differently, and sometimes your brain needs a little extra stuff to help it along. And I also ask kids, do you know why you think you might need the medicine? And kids will usually say, well, sometimes you get in trouble at school because it's really hard for me to raise my hand first, or it's really hard for me to, read something and know what it says the first time. So sometimes a lot of kids know why they need to take it. And also it depends on the whole family's attitude about it too, I think. So if you have one parent that says, well, I don't think you really need it, then it's going to be more difficult if you have one parent that is for it and one parent that is not so crazy about it. So, but I just tell kids, that everybody's brain works differently. And just like, someone needs glasses and for their eyesight and someone needs insulin for diabetes, sometimes people need help with their brain chemicals.
So do you think it's important at 7 years old to introduce the term ADHD, Stephanie?
I think it really depends on the kid and the family's views of that. I think that when I've talked to kids about just having their brain works differently, sometimes that answers kids' questions. But a lot of kids have heard the term ADHD, so it really depends on the parents and how they feel about that. And I would go a lot with parent intuition, because sometimes 7-year-olds, they don't really care about the name ADHD. Some 7-year-olds want to know what it is. So again, I would ask your kid what questions they have, and just go from there.
Right. One size doesn't fit all, for sure.
Right.
Okay, so JC has an 8-year-old with ADHD, also has a very extremely high IQ, and he's recently developed test anxiety, and he gets mad at himself for getting poor test scores. So the teachers and parents don't make a big deal about it, yet he seems to not be able to let go of it. So any ideas helping him through this test anxiety and getting angry with himself?
Well, I think it's really important that JC knows that through parent intuition that something's going on. And I would just reinforce that parents are the experts on their kids. And if you feel like there's something that's not quite right, then there's something that's not quite right. So you might want to meet with guidance and have a staff meeting where you talk about your child's test anxiety, and maybe work with the teachers and guidance staff on ways to reduce test anxiety. Maybe it's just having your kid walk around down the hall, run an errand for the teacher just to get their brain chemicals boosted a little bit through movement. Maybe it's doing oral tests instead of written tests may help. So there's a variety of different things that may be causing test anxiety. And that's especially frustrating for kids with high IQs, because they know that they are able to do more work than what they're doing. So I think also just validating that frustration, saying it must be really tough when you know the answers and they're just not coming out of your brain. And I think that helps a lot, that validation. And again, meet with the staff, meet with guidance, and then talk about some ways to make life a little bit easier.
Okay, so validation, empathy, all important stuff, right?
Mm-hmm.
Okay. Lynn says that her 15-year-old has been on Concerta since 2nd grade with positive results. She has a new doctor who wants to change meds, which, Lynn says, okay, not a bad idea. But she'd like to know, what are some things she should bring to the doctor's attention? What questions should she be asking the doctor?
I would ask why is their medication changed? Tell me a little bit more about that. Bring in any documentation you have, any of your kids' work that they've done in school that you want to show, how they perform. Maybe if you even have something prior to 2nd grade that shows, what grades were like then and then what grades are like now in high school, can be helpful. And I would just say, it sounds like there are some questions, from what I'm kind of intuitively thinking, is that there's some questions about why the medication was changed. And I would always kind of state the obvious, go, hey, so the medication's being changed, and I'm just curious as to what's kind of behind that. It might be an insurance issue. It might be that doctors have more success with a certain medicine. But again, you're the expert on your child, so it's perfectly acceptable to ask those questions.
Okay, great. Thank you. Ian wants to reflect back on when we spoke about exercise and green therapy. Would like a little bit more information about green therapy, Stephanie.
Sure. Green therapy is kind of a fancy way of saying playing outside. And anytime that you're outside, as one of my clients said, it hits Control-Alt-Delete in his head. It kind of resets his brain. And when you're outside playing, your voluntary attention shuts off, which is the attention you use to focus on schoolwork that makes your brain really tired. And your involuntary takes over, which is stuff like blinking and breathing. So you're giving your brain a break by being outside. And by green therapy, it doesn't necessarily have to be green. It's any kind of open space. So any kind of park, or even during winter, being outside and just moving around helps. So again, I tell people that when they take a break from doing homework or at work, to go outside when you take a break. Go walk around outside. And again, just being outside kind of resets the ADHD brain.
Okay, great. Thanks. Another question here. There's several other questions. Lake Mary Mom says her 9-year-old has ASD with cognitive impairments. And after working with a developmental pediatrician, the child isn't responding to ADHD medications and, in fact, is having adverse reactions to it. They have an intensive OT prescribed sensory diet during homeschooling. I am and the speech language pathologist are comfortable homeschooling him. What else can you advise to have him improve attention to tasks?
It's really hard for me to tell that because I would need to do a full evaluation. But I would add that if you have any questions about your child's medication, make sure you ask the doctor. And what I tell parents is anytime your child doesn't seem like they're being themselves or your child feels like they're not themselves, they tell you that they feel kind of funny, always contact your doctor. Really important to get in contact with them because they'd rather know now that something's going on rather than 2 weeks down the line when you have an appointment. But it's very hard for me to make recommendations. I don't know your particular child, so I would ask your questions to your. It sounds like you are kind of asking questions to the professionals. What should I do from here? How could things improve? But again, I would always keep the idea that you're the expert on your kid.
Great. All right, we're running out of time. We have time for one more question. And Val is asking about food. Her son loves carbs, bread, pasta, pretzels. Is there a link between ADHD and carb cravings? The child also takes medication for ADHD.
So first, carbs boost dopamine levels, and dopamine is one of the chemicals that you're low in when you have ADHD, and there's some evidence that boosts serotonin as well, and serotonin is also a brain chemical that you're low when you have ADHD, and it's also something that happens when people are depressed too. They eat more carbs. Carbs just make you feel better. There's a lot of comfort foods that have carb in it, macaroni and cheese, pasta. It depends on what you eat when you're growing up, but, pasta always tastes good. I'm a pasta fan. So it's one of those things that carbs, there's something that we just generally tend to gravitate towards so when we need a little comfort. And also they help boost brain chemicals, and they also taste good. So it may be that the kids are just drawn, again, they're particular about certain foods. So there are ways that you can substitute carbs, and there are vegetable-based pastas you can use and things like that. But that's where I probably talk to a registered dietitian just to see what your options are. But there is a correlation between eating carbs and boosting brain chemicals.
How do you find a registered dietitian, Stephanie?
You can ask your pediatrician. There's also a national organization online. You can just type in registered dietitian in my area and they'll list who's available. Nutritionists are not registered or licensed, but dietitians are. So just want to keep that in mind. So you're looking for a registered dietitian. And any doctor's office usually has a recommendation of a name. But I would use your Google and Google registered dietitian in your city. And then you'll see the reviews of them. Okay. And then also you'll see the national organization for them as well.
Okay, great. Great to know. So just as we wind up, Stephanie, any final takeaways for parents who are confused about treatment options for their kids with ADHD?
Sure. I think it's really important to ask questions. And any question is totally acceptable for you to ask. And again, you're the expert on your kid. If you think something's not quite right, then something's not quite right. And sometimes you have to go to different clinicians to find one you click with. And there also are options available, and it can be overwhelming sometimes. But when you find a good, reputable source, like Understood, I think it really helps you figure out, what's legitimate and what's not. And also that there is hope for treatment, and your kid can have a good quality of life.
Okay. What a great way to wrap up. So thank you so much, Stephanie, for being with us today. It's always a pleasure, and you have such great information and the research to support it. So thanks for being with us today.
Thank you.
And for our viewers, thank you so much for joining us today. If you've missed any portion of this chat or you'd like to watch it again, we archive all of our chats at u.org/calendar. And don't forget to join the Understood community at u.org/community to speak with other parents and experts about any challenges you may be facing. Thanks once again for being with us, and have a great afternoon.